Hello, everyone, and thank you so much for joining us and tuning in to MSA 101 with Lasso. My name is Sadie Palmer. I am the team leader of training and education with Senior Marketing Specialist. And today we brought in Michelle Skinnendor. She is with Lasso, and she will be the one presenting today. Senior Marketing Specialist and Lasso have been working together for a few years, so it's always great to be able to partner with them and do these sorts of events for you all and these sorts of trainings with them. But I will keep my intro very brief. Let's go ahead and get into the 101 of what Medicare savings accounts are.
Great, thanks Sadie. Hi everyone, thank you so much for joining today. My name is Michelle Skinnendor. I'm the sales manager for Lasso Healthcare, and I'm super excited to really just talk a little bit about Lasso Healthcare and then also do a really good Medicare MSA training for everyone. You know, it's such a unique product and it's so different than what most of you are used to. And if you're not working with it on a day-to-day basis, it can just get a little bit confusing. So happy to go over everything with you all. So first, I want to share a little bit about Lasso Healthcare. Established in 2018, we first launched our medical savings account, or MSA, in January of 2019, and we're currently in our 5th plan year with an active membership. With that information, we are the nation's leading medical savings account carrier with over 80% of the market share. Now, to offer best-in-class experience, we do partner with some third-party administrators who provide claims processing as well as rewards program support. And on the banking side, we partner with a well-known national banking entity who administers the MSA's banking component. When it comes to distribution, we really do heavily value our relationships with our agents and brokers. You know, the MSA is not your typical run-of-the-mill MA product, so it really is primarily broker sold for those of you who are out in the field. So we super appreciate everything that you guys do for us. In November of 2021, we were purchased by Zing Health, a Medicare Advantage carrier with MAPD products available in select counties across Illinois, Indiana, and Michigan. This partnership really allows us our continued reach towards our goal of eventually having that national footprint and bringing the MSA to Medicare eligible seniors who may have had very limited MA choices available to them. When we're out in the market, we are 2 completely separate carriers. So different products, different branding, we're totally separate. However, on the agent side, you're going to see this combined Zing Health plus Lasso Healthcare logo out there, not only within the onboarding process and, around the AHIP website, but it's going to, you're going to see it in our broker communications as well. So whenever you see an email from either Zing Health or Lasso Healthcare, you can bet that it's going to have information really that's applicable to both partnerships, because we want to continue to build that brand awareness. Also, because our processes operationally are very much intertwined, when you're going through the onboarding or even the certification that's going to be upcoming for 2024, you're going to see that we have very similar steps. So you can pretty much pick whether or not you want to get contracted with Zing Health, whether or not you want to do Lasso Healthcare, or if you want to do both, you can do that too. So it's a very streamlined process when it comes to the agent side of everything. Here's a timeline that we put together, really just to show everyone, where we've been and then where we're going. Again, established in 2018, we first launched our MSA into 17 states. And since then, we have more than doubled our service area over the years. And we do have a goal of continued expansion across the nation. So why the MSA? Why are you sitting here listening to someone talk about a product that you've probably only seen mentioned on AHIP once or twice over the past X amount of years? Well, there has been very strong historical growth of health savings accounts, or HSAs, which is the MSA's commercial side equivalent. Now, when we say growth, we are talking millions. Specifically, HSAs have grown from 4.5 million accounts in 2007 to 30 million accounts at the end of 2020. Now, when you take those numbers and you're adding in the thousands of individuals who are aging into Medicare each day, we've all heard 10,000 Medicare beneficiaries are enrolling, or like the silver tsunami even. Many of them are familiar with the HSA. So it makes sense that that demand for a comparable within the Medicare market is greater than it's ever been before. And the MSA is the only product that comes close to what those individuals are hoping to find. Additionally, if you were to look at all of the Medicare beneficiaries out there who are enrolled in a Medicare Advantage plan, there's only about 0.04% of them that are enrolled in an MSA plan. So that represents a massive underpenetrated opportunity for you guys as the agent, and you have that ability to really introduce a new product to those out there and bring something new to your clients. So what exactly is an MSA? Well, there's many types of Medicare options available out there. We're all familiar with them. You've got original Medicare, Medicare supplements, and Medicare Advantage. The MSA is one of several different types of Medicare Advantage plans. MSAs have two pieces. There is the high deductible health plan, and it is paired with a tax advantage savings account. And the savings account is an important part of the MSA's overall value. Our banking partner is Optum Financial, so they are the ones who administer that MSA account for our members. Now, when speaking about the operation of an MSA, it's pretty straightforward. In fact, it's probably one of the most basic, simple MA products out there. First, there's a deposit. So we deposit money received from Medicare into the member's medical savings account, which we open for them during enrollment. The member then decides how to spend, save, or invest those funds. So no one can control what a member does with their money in their medical savings account. It's their money, their decision to use it as they wish, but we do have recommendations on how a member can best use those funds to get the most value from the MSA plan. And I'll cover that here in a little bit. It is a high deductible health plan, so 100% of the services received below the plan deductible are the member's responsibility. Once the member meets the plan deductible, we cover 100% of the Medicare Part A and Part B costs going forward. So it's a very clean process. Everything below the deductible will fall to the member, and all of the Medicare items above the deductible fall to Lasso Healthcare. Any funds remaining at the end of the plan year roll over. So it's not a use it or lose it proposition. Even if they leave the plan, the member takes that remaining amount with them for continued tax-free use on qualified medical expenses. Now, when we look at joining the MSA compared to other MA plans, there are going to be some differences. Not everything here is specific to the MSA, but I will call out those that are. So first off, they must be Medicare eligible. They must live in the Lasso Healthcare MSA service area. They must reside in the US for 183 days or more during the calendar year. They're not allowed to have other coverage that would cover their MSA plan deductible. So this is going to be any benefits that you would find under an employer or union group, TRICARE, veteran benefits, or your federal employee health benefit plan. Now, I do want to specifically point out veteran benefits here because I do have a lot of agents that really think that this is the perfect plan for their veteran clients, because maybe they use those VA drug benefits, but when it comes to the health benefits, they're not really getting the most from them. Unfortunately, the Veterans Administration does not have any way to separate those two coverages. So even if they're only using their drug benefits, they're not using the health benefits, this is not going to be a plan that they would be able to enroll into. The next one here, they cannot currently be eligible for Medicaid. and they cannot currently be receiving Medicare hospice benefits. So as long as someone meets these 6 criteria and then also has a valid enrollment period for the MSA, they should be able to become a Lasso Healthcare member. Now I want to review some of the unique features that come with this product. First, MSAs are the only Medicare Advantage plan that gives the member money. So this is done every single year that they are affiliated with the health plan. They're going to get a new deposit and really be able to grow and earn from that piece of it. We are a $0 premium plan, and that is by law. So unlike other Medicare Advantage plans who may have a $0 premium, those are benefits that they build into their plans each year and submit to CMS for approval. We do not do that. We will always be $0 no matter what. It's a law. We have no network, so MSA members have access to any Medicare provider who agrees to see them with no referral or prior authorization required. We are a true Medicare Advantage only plan, so there is no integrated drug coverage with this product. And that's really great because it's going to open up that ability for you as the agent to mix and match that coverage that's going to best fit your client's needs. So you're going to be able to look at their drugs and look at their pharmacies that they like and make sure that they get into a plan that's going to best suit them. MSA funds can be used tax-free on all IRS deemed qualified medical expenses, even those that are not otherwise covered by Medicare. And I'll get into that a little bit as well. Now, with so many characteristics, the MSA can be a valuable option to many different types of Medicare beneficiaries. So if you're sitting there trying to figure out who in your current book of business or who you want to market to as a new client, we've really broken it out into 5 different groups that really should help you because we've seen these individuals really see the benefit from the MSA. So first off, we have travelers and snowbirds. They're going to be drawn to the MSA because of the broad access. Their healthcare isn't restricted to a network of providers, which is going to offer them more flexibility. So whether or not they live in the north and they travel to, let's say, Florida for the winter, maybe they just have kids who moved across the country and they want to go spend a couple months with them. This is truly a product that is going to travel with them. So they're going to continue to be able to get care no matter where they go. Now, one thing I do want to point out is when we say travel, we mean traveling within the US and any islands considered part of the US. This is not going to be ideal for foreign travel. And that's really because we follow the guidelines of original Medicare. Next one here, HSA fans. If someone has an HSA balance and they're moving into Medicare, the MSA is a perfect landing zone for them. They're going to understand it more. Plus, they can use their HSA funds to help cover their member responsibility portion of the MSA. If they work with a financial advisor, they're also going to be able to identify ways to really strategically use both their MSA funds and their HSA funds for a greater amount of tax savings because they do have different rules associated with each of those types. People with in-control chronic conditions. You know, the claims data that we've seen over the past few years really does support that the MSA can be a great choice for those who have in-control chronic conditions, assuming that number is limited. So if you do have a patient that's going in and out of the hospital or has been in and out of the hospital at least once or twice within the past, 3 to 5 years, this is probably not going to be a good plan for them. But if, let's say, your client has high blood pressure, diabetes, high cholesterol, as long as they're receiving regular care, they continue to take their required medications, they can do extremely well in this plan and end the year with money left in their account because that's where that value is. Health enthusiasts, enrolling in the MSA should really be an easy choice for this group. Their provider visits are most likely going to be limited to preventive care, which is going to allow them to grow their account more rapidly and really build up all of those funds and save them, and essentially creating a nest egg for down the road. Let's say their health takes a turn in a different direction. They have those funds then sitting there that they can use towards their healthcare expenses. And the last one here, MedSup enrollees. Anyone who is turning 65 and interested in a Medicare supplement plan, maybe because that broad access, or let's say someone's over 65 and already enrolled in a Medicare supplement plan, but they're really just tired of their premiums getting out of control. Those individuals are going to see a substantial amount of savings if they were to move to an MSA plan. They're still going to have that broad access, but then they're going to have that $0 premium. So they're not going to be spending a whole bunch of money on that premium and seeing it essentially go to waste. I also want to point out, because I know most of you are in Missouri, with the birthday rule in Missouri, this is a fantastic product because you don't have to worry about your clients, repricing their meds up every single year on their birthday. You're going to be able to see more retention with your current client base if you look at the MSA product. A couple of other vital components of the MSA are related to enrollment and disenrollment periods. So this is probably one of the most important slides of the entire deck. And that is because compared to other Medicare Advantage plans, there are limited opportunities to get in and out of the MSA. When we talk about enrollment can occur in only 2 instances. So that's going to be AEP, so October 15th through December 7th annually, or during someone's ICEP. Now, the ICEP can actually happen at a couple different times. It can happen if the Medicare beneficiary is under 65, disabled, and newly qualified for Medicare. If they are just now turning 65 and newly eligible for Medicare. Or let's say they're over 65 and they deferred their Part B. They're now retiring, enrolling into Medicare Part B. That ICEP window for that group is the 3 months prior to their Part B effective date. There are no SEP enrollments allowed at all with this product. Now, when it comes to disenrollment can occur during AEP, but then is also limited to a set of 5 SEP circumstances. That's going to be if there is a permanent move out of the service area, if they gain Medicaid eligibility at any point throughout the year, CMS is going to kick them out of the plan, if they gain other coverage which would duplicate their Medicare Part A or Part B services, if there is a 5-star Medicare Advantage plan in their county, they can enroll into that. And the last one here is the trial period, and it's specifically the trial period for those who left a Medicare supplement to enroll in a Medicare Advantage plan for the first time. These individuals can disenroll from the MSA anytime within the first 12 months to go back to original Medicare with that ability to get into their Medicare supplement plan. Now, there are no other SEPs allowed for disenrollment, and that includes those that are disaster or weather related. CMS does not allow those SEPs with the MSA. You're also going to notice that I did not talk about OEP. And even though it's a Medicare Advantage open enrollment period, and the MSA is a type of Medicare Advantage plan, CMS strictly prohibits any movement in or out of the MSA during that time frame. So that's a really, really important thing to know, especially if you are presenting this product to your client during AEP. You do not want to give them the indication that they're going to be able to leave the plan during that January through March timeframe if they're unhappy, because that is not the case. They will need to have one of those 5 qualifying SEPs in order to leave the plan. Now, as an agent, you're probably wondering why. Why are there so many extra restrictions when it comes to enrollment and disenrollment with the MSA? And it all comes down to the banking component that comes with this product. So here we have information on how mid-year enrollment and disenrollment works. Of course, if your client enrolls for a January 1st effective date, they're going to receive the full deposit and be responsible for the full deductible for the plan they've chosen. However, if someone enrolls during their ICEP window, both the deposit and the deductible are prorated based on the number of months that they will be enrolled with the plan. So the slide here shows an example of an enrollment effective April 1st. This member is going to receive a 9-month prorated deposit, and they're going to be responsible for a 9-month prorated deductible. If you are talking to someone in their ICEP window, you can go out to our website, lassohealthcare.com/learn, and you'll be able to find those exact dollar prorated amounts for the plan by month listed out. So you'll know exactly what to tell your client. Now, when there is a mid-year disenrollment where that member meets maybe one of the limited SEPs, or let's say they pass away because death is also considered a form of disenrollment, that individual is going to owe back any unearned deposit funds to the health plan. And that's because CMS pulls it back from us. So the slide here shows an example of a disenrollment effective July 1st. This individual is going to owe back a 6-month prorated amount of that current year's deposit only to Lasso Healthcare. And they will be responsible for that full year deductible. The deductible is not prorated upon disenrollment. Now, if the member remains in the plan through December 31st, they keep 100% of those funds. If they are a new member, or not a new member, if they are going to stay in the plan, they're going to get a new deposit that following January. If they were to leave the plan, so let's say they go back to original Medicare, maybe they enroll into a Medicare supplement, maybe they enroll into a different Medicare Advantage plan, they're going to keep everything left in their account as of December 31st. Fun fact, as of December 31st, 2022, 97% of our members had funds remaining in their account. That's 97% of Medicare beneficiaries out there who earned money from their health plan. That's huge. And it also just adds to our retention rate. We have a fantastic retention rate with this product because after that first year, if someone sees that, wow, I got $2,000 at the beginning of the year, I only use maybe $500 of it, I've got $1,500. I can do this again and I can make more. That is huge. And again, that's going to be great for you as the agent because as long as they're in the plan and you're that AOR and you're certifying, guess what? You're getting paid on the product. So as mentioned earlier, Optum Financial is our chosen banking partner for that medical savings account. So when the Medicare beneficiary enrolls into the health plan, they're also completing an application to open a medical savings account with Optum Financial. So if you were to go out there and look at our paper applications, you would see, and even the electronic applications, but if you're looking at the paper applications, you're actually going to see one added page that is branded Optum Financial, and it's going to ask some questions. If you are using our online enrollment process, which is preferred, you don't really see that extra page because we pull a lot of the information from everywhere else, but you will notice that in addition to the MBI, which is needed to open, to enroll in the health plan, we also require the social security number for your client. And that is needed to open up a bank account. It doesn't matter what kind of bank account you're opening, that social is required for within the banking guidelines. So know that that's going to be a step. Also, make sure you're entering it in correctly. So you want to verify that it's accurate as it's being written on the application or typed into the application. If there's any variance of that social, maybe a mistyped number, maybe the client is giving you their spouse's social because they want it to be in their spouse's name. That's going to impact the timeliness of us getting that account opened, and it could impact us, even enrolling that member into the plan. So it's really important that you make sure those socials are accurate at the time of application. All that said, once the account is open, the member is going to get a welcome packet from us. That packet is going to include their debit card, which is going to that's how they're going to access their MSA funds. It's also going to include information on how they can set up their member portal with Optum Financial. And that's really important because once they've got that set up, they can view their monthly statements, they can track their transactions, but they can also set up their beneficiary. And that's a really key important piece because you never know what's going to happen. And if someone has this account, they're earning money, we want to make sure that those funds get to the beneficiary of their choice. So go in, they can set that up with Optum Financial. If they don't take that step, those funds are still going to be distributed, if something were to happen to them, but it's going to be to whoever's in charge of their estate after, at that time. A couple of other important things that I just want to mention really quick regarding Optum Financial. So first off, as long as the member remains in the Lasso Healthcare health plan, we pay all of the custodial fees for our members. So if they were to leave the plan and go to a different one and still had money left in their account, they will start to see those maintenance fees. So that's the key point to note. I think it's about $2.50 a month. So it's nothing crazy, but they will start to see those all of a sudden. Next, I want to mention that they do have the ability to move their funds. So they can move their funds away from Optum Financial as long as they move them into another medical savings account. So MSA funds have to be in a medical savings account and under that Medicare beneficiary's name. If they're moved to someone else's name or commingled with any other funds, they're going to be taxed. Lastly, Optum Financial offers the MSA member the option to invest any balance in that account over $2,000 to potentially grow those funds. And that is amazing. And MSA members are not otherwise allowed to contribute or add money to their account. So this is really the only way that they can grow those funds aside from being a continued member each year. So this is going to really pique interest in your clients who maybe have a financial background. Maybe they just, like to invest. They go out there, they are very familiar with that whole side of the business. This is going to be a really great plan for those individuals, at least one to present to them. Now, I do get asked a lot what types of investments are allowed, and that information I really don't know. So because this is a benefit that Optum Financial is offering, we as the health plan don't have very much information. All I know is that the investments need to maintain within Optum Financial, and there is a variety of investment vehicles that member would have access to choose from. Now we come to payment responsibility with the MSA. So earlier I'd mentioned that no one can control how a member spends their funds, but we have recommendations on how they can use them to get the most value. So this slide here shows 3 categories a member can itemize their expenses under. So first on the far left, these are your Medicare Part A and Part B covered expenses. They're also considered qualified medical expenses or QMEs by the IRS. MSA funds can be used tax-free on all of these expenses, and the amounts accrue to lower the deductible. So if a member can use their MSA funds solely towards Medicare covered expenses, they are going to get the most value from this plan and spend the least amount of money out of pocket. Now, one of the benefits about the MSA is the flexibility that it does give the member. They can choose however they want to spend those funds. So the middle category here, these are your non-Medicare qualified medical expenses. A few examples of items in this group are going to be your dental, vision, prescription drug copays and deductibles. MSA funds can be used tax-free on these items, but the key difference is they do not count towards the plan deductible. For a full list of items in this category, you're going to want to reference IRS Publication 502. So if you've never seen that before, I highly encourage you to go out there, just check it out, save it to your bookmarks. It really is a very extensive list of what the IRS says MSA funds can be used on tax-free. Now, The far right side of the screen, this is everything else. It's any item that is not a Medicare Part A or Part B service. These items, or an IRS qualified medical expense. So these items are going to be subject to ordinary income tax as well as a 50% penalty. That's a 50. That makes this category the worst one possible to spend MSA funds on. One thing that most don't realize falls into this category is the use of a member's MSA funds to pay for a spouse's or dependent's health care. When MSA funds are used to pay for services other than the member, they're then considered non-qualified expenses and would be subject to additional taxes and penalty. So again, another important slide, you really want to know the difference between these three categories so you can best educate your clients. That way they're making wise choices and decisions when it comes to how they're spending their money. So when a member uses their MSA funds for any amount or any reason, there's special tax reporting requirements that they must follow. The MSA funds are not taxed when they're added to the account, they're not taxed while they remain in the account, and the gains are not taxed as earned and in the account. So other than at death, MSA funds are taxed only when used for non-qualified medical expenses, which the IRS decides when the member files their taxes each year. Fortunately, Optum Financial makes this process very easy. They send out a Form 1099 SA to the member in January. The member's going to then use that form along with their receipts and IRS instructions to complete Form 8853 and Form 1040 Schedule 1. Now, I think most seniors nowadays, they're either going to be having a tax advisor do their taxes for them. So any tax professional is going to know how to do this. There are also a lot more that are a little bit savvier now. They're going to be on their computers. They're going to be, doing their own taxes. Even if they want to handwrite them out, they can. If they do use any sort of home tax software, so the computer's tax software, or maybe they've got a family member that does their taxes for them, those softwares, they're going to identify HSAs as well as MSAs. So it's a very clearly asked throughout the process, do you have an HSA? Do you have an MSA? All they need to do is answer yes and then follow the steps. So it's actually a really easy process. I do want to point out though that information on qualified medical expenses as well as the tax process as a whole, those are always subject to change by the IRS without any notification to us as a health plan. So if your client does have any questions, it's really in their best interest to speak with a tax advisor. I'm not a tax advisor. I know most of you are not tax advisors, and we want them to have the most up-to-date and accurate information possible. So as mentioned earlier, the MSA does not come with drug benefits. The member will need to enroll into a standalone PDP drug plan. And while they can use their MSA funds to pay for copays, coinsurance, and deductibles for that drug coverage, it's essential to note that they cannot pay for the premiums associated with that coverage, at least not tax-free. So the only premium the MSA funds can be used on tax-free are those tied to long-term care policies. So this slide does a really great job of clearly identifying that. You can see that there's only one check mark under the premiums column, and it is next to long-term care. However, you have check marks under copays, coinsurance, and deductibles for all of your other common coverages. And we really do encourage agents to cross-sell other benefits with other plan benefits with this product, not just a PDP. A hospital indemnity plan is a fantastic pairing with this product, especially for those who really want to try it out, but maybe they're hesitant that, what happens if they go to the hospital and they're inpatient and they're admitted? That HIP plan is going to help cover them in that instance. Critical illness insurance is also an option, as well as your dental, vision, hearing benefits. So great product for agents because it's going to offer you a lot of opportunities to sell and serve your clients. Now let's talk a little bit about clinical access with the MSA. Lasso Healthcare does not have a network of providers, so this is going to give the members access to choose their healthcare services and their providers as they wish. Ultimately, the MSA can see any provider that agrees to see them, but selecting a Medicare participating provider is going to bring them the most value. We do not have a list of providers that work with us because, again, we do not contract with providers. So if a member wants to locate a Medicare participating provider in their area, they can go out to medicare.gov and use that physician finder tool. Now, when a member goes to a Medicare participating provider, they're going to pay the lesser of the billed charges or 100% of the Medicare rates. All of the Medicare covered costs are going to count towards the deductible. If a member were to go to a non-participating provider, they're going to pay the same as participating. However, they're also going to be responsible for any balance bill charges or limiting charges where allowed by state law. And that's typically an additional 15% that's added to that Medicare amount. The excess charges are not reimbursed by the health plan, and they do not count towards the deductible. If a member were to see a provider that opts out of Medicare completely, there's going to be a private contract between the provider and the patient. Medicare does not limit the billings, and charges are not reimbursed by the health plan and do not count towards the deductible. While providers in this category are a very, very small percentage out there, they do tend to be your specialty dentist or specialty mental health providers. Now, it is important to note that providers can decide at every visit whether or not they want to accept the MSA plan and agree to treat the member. Except for in emergencies, members cannot be denied emergency care due to their insurance plan. That said, we have thousands of providers who have accepted the MSA, who continue to accept the MSA, and that includes some of those large and some of the most renowned health systems out there. So even those that don't typically work with other Medicare Advantage plans, they do accept Medicare. So that's kind of our foot in the door, and we are able to work with them. Before a member receives any services, we do encourage them to reach out to their provider and just let them know that they are enrolled in an MSA plan. You know, this product is not just new to agents like yourselves. It's not just new to Medicare beneficiaries out there. It is new to a lot of providers because, again, it has not been a very widely offered product. And on top of that, remember I had said it's a very, very, very small percentage of actual MSA Medicare beneficiaries out there enrolled. So it's not uncommon for providers to need a little bit of education on not just who Lasso Healthcare is, but what an MSA is and how it works. So this past July, we did start to implement a provider card. So along with the member ID card we sent out, we send a provider card. And it's very similar to the screen that's showing for everyone, but it speaks to the provider. But it's going to give them some information on how it works, what those reimbursement rates are, and then also how the claims process works. Our information is on that card. So if the member goes to their doctor and that provider has any questions, they can reach out to us and we will be happy to answer anything that they've got. We do see a lot more acceptance with the MSA since providing these cards, which has been great. On top of that, you know, once the provider learns that the reimbursement rate is 100% of that, you know, Medicare fee schedule, those are amounts that they're already familiar with from their current clients. So it's nothing that is going to be unfamiliar to them. Also, there's providers out there that might be a little bit hesitant because, you know, they hear high deductible plan and it kind of scares them away a little. But when we share that we're providing our members with a deposit up front to start using day one towards their healthcare services, that really, really calms them there too. So yes, providers can choose at every visit, but this really isn't something that you should have a lot of concern of. So here's how the claims process works with the MSA. It's really like any other Medicare Advantage plan that has a $0 copay. First, the member is going to go to their appointment. They're going to show their Lasso Healthcare member ID card along with their provider card, which again explains the MSA. They're not supposed to show their Medicare card, and they're not expected to pay any copay. After their visit, the provider will bill Lasso Healthcare. We will reprice that bill to 100% of that Medicare rate. If then we bump it up towards the member's deductible. If the member has hit their deductible, we will pay the provider the amount owed. If they have not hit their deductible, we send the member a explanation of benefits, letting them know what they're responsible for. But then we also send a notification to the provider, letting them know what that member's responsibility is. At that point, the provider will turn around and invoice their patient or our member. The member is going to get that invoice. They're going to bump it up to their EOB, and then they're going to go ahead and pay it. If there's any discrepancies, 9 times out of 10, it's because the provider did not bill the correct amount. So reach out to their provider first. Otherwise, you're more than welcome to reach out to our teams, and we'll be happy to review that. I also want to point out on this page, just because we mentioned the explanation of benefits, we launched just recently, I would say within the past couple months, a member portal. So members can access that from our website. They're going to go out there, they can register for it using their information on their Lasso Healthcare ID card. They're going to be able to view and download those explanation of benefits that are going to show that they're going to be sent. So if they haven't received it in the mail, or maybe they've lost it, they have access to view those on demand. They're also going to be able to track their deductible amount. So that's really great. And they can also be able to see claims. So if you weren't aware that we had a member portal and you have clients on the book, definitely look into that, let them know about it, because it's been really great for our current members. So here we take a quick look at our rewards program. So this is a benefit that is specific to Lasso Healthcare and is really our way of giving back to the member while remaining within the guidelines that CMS has for the MSA. While the program is completely optional, participation is highly encouraged. Members can earn up to $300 above and beyond their deposit just by completing 3 activities. So first, there's the annual wellness visit. One of the things that we've really struggled with as an MSA plan is getting our members just to go to their doctor each year for this AWV. Many of our members are enrolled, because they're healthier, they really don't want to go to the doctor. They don't want to, go unless they're sick, which is totally understandable. However, it's important to us that the member go to their provider each year for this AWV and just remaining on a healthy path. The AWV can be done in person with a provider of their choice, or they can do it telephonically through our partner, Oak Street Health. The AWV itself is at no cost to the Lasso Healthcare member, and that's new for 2023. And the reward that they can get is $175. So it's a win-win for them. Next here, they can do a health survey. It's equally as important as the annual wellness visit, as it helps us learn more about that member. If they complete it, it's another $75 they're going to get. We also extremely value the opinions and feedback from our members. So whether it's good or bad, we want to know what their thoughts are. So this year we've added a new activity, which is the member experience survey. So the member is going to be contacted about halfway through their membership with us, and they're just going to be asked to complete a short experience survey. If they participate, it's another $50. So again, they can do all 3 of these. They can do one of them. It's completely optional, but it's a very easy way for our members to earn up to an extra $300 each year that really they can do whatever they want with those funds. So once they complete their activity form from their chosen whatever activity they're doing, they're going to go ahead, submit it to us, And then our partner nation's benefits is going to process that reward via a reloadable rewards card. The member's going to get that, and they're going to be able to use those funds towards services where they need them the most. So whether that is transportation, maybe they want to go use it all on OTC benefits, maybe they just want to go out and have a fancy dinner, they can do that. We even have members who use it for their monthly or weekly barber or beauty shop appointments. So they go to the salon every Saturday morning. We all know some old ladies who do that. My grandma specifically. So this is great, and it's just another way that they can, feel appreciated by the plan just by completing some little activities. So here's our service area map for 2023. The Lasso Healthcare MSA is in every single county across 35 states plus the District of Columbia. For 2023, our top AEP states were Wyoming, Kansas, Oregon. And then our 2023 top membership states include Texas, Kansas, Wyoming, Montana, and Oregon. So just based off of that information, it's pretty evident that this is a product that thrives in the rural markets. In fact, over 60% of our Lasso healthcare members reside in a rural environment, which is pretty crazy. So definitely those areas that don't have a ton of other MA saturation. Here we look at our plan designs for 2023. This is actually our third year with these exact plans. We have had a lot of success with these deposit and deductible amounts, so we decided to keep them the same. Our growth MSA on the left, this is tailored to individuals looking for lower financial risk. Members in this plan are going to receive a deposit of $2,000. The plan deductible is $5,000. And when you apply that deposit to the deductible, that's what gives us their member responsibility, which is $3,000. Looking at the Growth Plus MSA on the right, the deposit is $3,000, the plan deductible is $8,000, and the member responsibility is $5,000. This one's going to be more attractive to returning members who have really accrued a balance in their medical savings account and have enough funds to cover most or all of that larger deductible. Current members can flip-flop between plans, so they just need to submit a new application to us during AEP. So depending on what they have upcoming for their year, as far as health-wise, they might want to, switch to the lower plan deductible if they were in the higher one, and vice versa. Now I want to further explore the value proposition of the MSA by comparing it to a popular Medicare supplement plan G. So we're going to discuss two scenarios here. We're going to look at someone who has low utilization and then someone who has high utilization. Now, I do want to point out that the premiums are not necessarily accurate for your area. This is a slide I use on a national basis, and we all know MedSup premiums change based on your state and many other factors. So just kind of know that as you're going into this. Now I want to start with low utilization. So looking at the top left quadrant, here is where we show that over 10 years, the growth MSA plan member is receiving an annual deposit of $2,000. Over that same period, a Medicare supplement plan G member is paying an average premium of $1,440. Now, without factoring in medical expenses, the Plan G's premium alone over that 10 years is costing just under $20,000. The Growth MSA has no premium, and the members receiving a deposit each year, accumulating to $20,000. So right off the bat, if you're in a MedSup, you're spending about $20,000. If you're in an MSA, you're earning about $20,000. Next, we're going to move to the bottom left quadrant. And here's where we start to layer in some of those medical expenses to see what the balances look like. So we account for a $500 spend on average year over year for the MSA. For the Plan G, we took out the 2022 Part B deductible of $233, and we all know that's even increased. Now we look at the totals. The MSA member expenses accumulate to greater than $6,000. Well, the costs for the Plan G are just over $2,000. However, When you take the deposit that comes with the MSA and you apply it to the medical expenses, the MSA member is still ahead almost $14,000 compared to the Med Sup member having spent over $22,000. So put another way, after 10 years, the member in the Lasso Healthcare Growth MSA spent $0 of their own money. They just used their MSA deposit and they earned almost $14,000, while the Medicare Supplement Plan G member spent over $22,000 and earned nothing. Now, we know having only $500 per year in medical expenses, that's not always going to be the case. That's definitely going to be our healthier members. So we want to look at someone with high utilization over that same 10 years in the second scenario. So everything in the top right quadrant has stayed the same. The only difference we have made to this side is to the bottom right quadrant. Here we have increased the MSA members' medical expenses from $500 to $5,000. So we have this member hitting their deductible for 7 of the 10 years. By doing this, the numbers rack up to a total of almost $37,000 under the growth MSA. But when you offset that amount with the annual deposit received, the growth MSA member spends just under $17,000 from their own personal finances compared to the $22,000 that the Plan G member has still spent. So even with these high medical expenses, the growth MSA member is ahead over $5,000 compared to the Med Sup member. And this slide just does a great job of really showing these two plans side by side and where that value is. It really helps agents, especially if they're trying to explain this product to their client and they want to show them that financial value. So I'm not going to go over this slide. It's pretty much the same information that I just shared, but I do want to point out that this slide covers our Growth Plus MSA. And with the higher deductible that comes with the Growth Plus plan, someone with high utilization is not going to be a good candidate. Their financial value actually falls to the Med Sup. And we want to share that. We want you to know that. We want your client to know that, because it's not just about thinking, is the MSA the right product for me? But you don't always want to gravitate towards that one that has a higher deposit. You never know what's going to happen with your healthcare costs. So it really is important that you have that conversation with your client, do a little bit of clinical questions there, and see which plan really is going to be the best fit for them. So we already know Medicare beneficiaries aging into Medicare are a good prospect to enroll in the MSA. They're going to be healthier overall, they're going to the doctor less, and they're going to grow their account more, most likely to remain in the MSA for a longer period of time. So what we look at with this chart is we want to look at someone who enrolled at age 65 versus a member who enrolled at age 70. So we do assume that the member is enrolled in the Growth Plus MSA plan. That's giving them an annual deposit of $3,000. Then we account for usage and expenses starting at $1,000, increasing to $2,000. And next, and potentially the biggest variable we have here, is we have this member utilizing that investment option with Optum Financial, resulting in a return. So from day one, they took that extra $1,000 and they invested it. And they continued to invest it and its gains every single year for that first 10 years. Now we look at each of them at age 75. The member who enrolled at age 65 has accumulated over $32,000 in their medical savings account. The member who enrolled at age 70 has a little bit over $10,000. That's a $21,000 difference and more for the member who enrolled as soon as they were eligible for Medicare. And that is huge, and it is so impactful. And it really does reinforce that you should be presenting this product over a period of time and as a financial decision versus putting someone in it just for healthcare coverage over the next year. And that's all I have on the plan itself, but I do just want to go over just a couple more slides here. We've got a few more minutes, so bear with me. First off, this is just all of our resources. So anyone you can call here with us regarding the MSA with product questions, contracting questions, really just anything. I am your broker contact. Again, I work our entire service area, so it doesn't matter where you're at. You can always reach out to me with any questions. We also have our agent support line listed, agent support emails, member services, provider services, and then we have Optum Financial listed if there's any banking questions. Here I want to share, because I'm not sure how many people know it, but we have recently transitioned our onboarding and certification process over to Evolve NXT. So Evolve was already the platform that we were using for commission. So if you're paid commissions directly from us, you would go into this platform to see your statements. But we have moved it over for everything else. It's really great. We're finally in one system that talks to each other. So it's always been a challenge in the past with the old systems we used. So you should all have emails associated with your user information if you are a current Lasso member or Lasso agent. If you're not and you're new, just note that this is the platform that you're going to be going through that process within. So we can provide broker guides out there, which will help you navigate this platform. So if you're not familiar with it, just reach out to someone on your team, and we'll get you that guide to walk you through it. But it's pretty easy, so excited for that. Next, your supply portal. So if you're looking to order any print supplies from us, you can do that through our supply portal. The supply portal is shared by Zing Health and Lasso Healthcare, so you'll again see our logos up there combined. Your login information is or was sent out to you. If you're a current agent, it had already been sent out to you. If you're a new agent, it gets sent out after you complete your certifications with us. The portal can actually be accessed directly from our website, and I'll show you that here in a second. But you're going to be able to go here, and this is where you're going to order any of your printed supplies. So enrollment kits, provider guides, MSA overviews, any print materials. We do have a variety of digital marketing materials as well as sales materials. They are in our Google Drive. So this is going to be for print materials. Our Google Drive is going to be for digital. The Lasso Healthcare website is a fantastic resource. If you are not familiar with it, go out there and look at it. It's not only going to be educational to Medicare beneficiaries or consumers, but you're going to be able to do enrollments directly from our website. So that's going to be either from the home page, the learn page, or the enroll page. You just enter in your client zip code, select the plan, and then enter in your NPN. And that's how that application is going to be tied to you. The agent page is going to give you access to that Evolve NXT portal that I just showed you for onboarding and certification. And also it will link you to the supply portal as well. So that's going to be towards the bottom of the agent page. The document section, it's going to include a lot of documents, not only member facing, but there's going to be some for agents as well. So like if you're looking for a paper scope, if you want to download a CMS approved sales presentation, maybe you have a current member that wants to disenroll, a disenrollment form is going to be required. You can download that there as well. And then also I had mentioned earlier, we've got that member services or that member portal that can be accessed through our website as well. So head out to our website if you're not familiar with it. We do offer online enrollments through other means as well. So in addition to Lasso Healthcare, you're going to see the MSA available on Connecture for quoting and enrolling. And then we're going live with Sunfire on May 15th. And then Ascend, we will be on there. I think that's May 17th. So in May, for sure, this month, we're going to have all of these options available for you. Lastly, I promise, as we wrap up, I want to just touch on really quick that we do have a marketing voucher program. So you can earn Zing points towards a 1,000 piece targeted mail drop. So if you submit an application anytime from April 1st through September 1st, If it's a Zing Health MAPD application that effectuates, it's going to get 100 points. If it is a C-SNP or D-SNP enrollment for Zing Health, it's 150 points. And if it's a Lasso Healthcare MSA enrollment, that is also 150 points. So there's no limit to how many points you can earn. Every effectuated application is going to get you points, and every 300 points will get you a 1,000 piece targeted mail drop. So really excited to offer this. We did offer a version of it during AEP, during OEP, and then we're going to continue it through the lock-in. But that is all I have for you today. So thank you again for sitting here listening to me. Sorry, I think I just used the entire hour. So it was a lot, and I really appreciate all of you for taking that time on a Friday afternoon.
Hey, thank you so much, Michelle. There was a lot of really great information in there. So if you have any questions, please feel free to reach out to Senior Marketing Specialist at 800-689-2800, and we are happy to answer your questions or get you connected here with our partners at Lasso. But Michelle, thank you so much, and thank you so much for watching, everyone.
Thank you.